representative of the state and trade unions. In our opinion, the centralization of social dialogue is a bad solution. Part of the fault for current situations belongs to the trade unions, which some of the mistake, I think, has concentrated on the perpetuation of a centralized mechanism for social dialogue, are focused on state-trade union relation created in the early 19th year, and which were not interested in providing flexible mechanisms adapted to new work conditions. The centralization of social dialogue is a legacy of the socialist system. The situation is grounded by the fact that main trade union from the health sector is the inheritor of the similar structure from the communist era, being characterized by centralist, resuming action only on wage matters, showing no interest in working conditions or on changing the legal framework, and in general without being interested in the great changes and challenges faced by the labor market in this sector, including the migration of healthcare professionals. This is one of the reasons for which the social dialogue in the health sector over the last 3 years has been limited to bargaining a contract at the group of hospital administrated by the Ministry of Health that is applicable only for 25 of workers and which was valid for only 25 of time from this period. Worker representatives have no right to be board members in Romania, although they may participate as observers at board meetings for some topics. Another problem, in my opinion, is that the social dialogue have in our country exclusively an institutional nature. Like I said, labor relations in Romania are featured by exclusive institutional nature of social dialogue. It is focused only on the mechanism and relations stipulated by law. We have a poor culture of social dialogue, and social dialogue also, like my colleague said before me, is meant to respect the communitary acquis. About public health sector, the public sector in health includes the overwhelming majority, roughly 98% of workers in the healthcare system. It is strongly affected by the introduction of the law on single wages. Right now, the unions being forced to negotiate in the same time with many partners, namely the government in terms of wages, with the ministry in terms of general work conditions and some social rights, and with the local authorities in terms of work conditions, social rights, and other matters subject to collective bargaining. Since the trade unions on public health sector are affiliated to 5 confederations, the effect is that they are facing great difficulties to coagulate a single common effective action in terms of wage bargaining, namely in the relation with the government. We have also a strong diminishing of the importance of public sector trade unions that is demonstrated by the defeat suffered in the context of economic and social crisis when we were forced to support cutting salaries by 25%. It is the largest cut within the European Union in terms of public wages. The reaction of union members, some example, the loss of a significant number of union members, reducing confidence in trade unions, and also is equivalent to a significant weakening of social dialogue, including the health sectors. Some words about legislative framework on social dialogue was created by law number 62 from 2011, which resulted in affecting the entire structure of social dialogue. Some of the examples: the abolition of the collective labor agreement at national level, the drastic restriction of bargaining conditions on collective labor agreements at the hospital level by worsening the conditions for obtaining representative. A trade union is required to have as members at least 50% of the employees in order to be entitled to participate at collective bargaining. These changes have stressed the weakening of trade unions also by eliminating facilities that had been previously granted to them, like 5 days of less paid for month for union activities granted to union leaders, the abolition of some social dialogue institutions at hospital level, sectoral and national level, a significant diminishing of the general provisions protecting union activity to the employer's pressure, etc. Also, we have an additional changement, the decentralization of the health care sectors. In the health sectors, the conditions are aggravated by the decentralization of hospital administration that resulted in taking out from the Ministry of Health patronage for over 75 from hospitals, from national hospitals. Since the local administrations is not organized as an employer, the law has a serious shortcoming in this respect. The trade unions had no social dialogue partner at national level. This shortcoming makes it impossible for them to negotiate the collective agreement at sectoral level in this moment. In this context, the only collective bargaining is at the group of units, respectively for the hospital under the Ministry of Health Administration, representing, like I said before, 25% of workers from the healthcare system. A special mention, a sad one. At this time, we negotiated a collective agreement. The registration is blocked by Sanitas Trade Union, an organization with socialist orientation which requires removal of us from collective agreement, in condition in which we satisfy all the conditions for collective bargaining being representative at this level. Some words about our relation with Eurofedop on social dialogue area. The main acquisition is represented by a good practice exchange between our organization and organizations member of Eurofedop. We also benefit of a workshop founded by Eurofedop on social dialogue. We had a very good exchange practices, especially with colleagues from France, Spain, and the Netherlands. Some photo from those activities. Yes, Bertrand, Bert. Regarding to our experience in this area, we consider it useful to intensify the exchange of experience between healthcare trade unions, organizations that are Eurofedop member, either through projects founded by the Commission. To some extent, the prospect of effective social dialogue in healthcare sector is dependent on the ability of trade unions for reorganization and our capacity to join effort in correlation with the state as the employer. We made a national project on the area of social dialogue. This project was submitted on Innovation Norway funds. Right now is in evaluation. Main objective of this project: improving social dialogue with dialogue within the health sector in Romania, increasing the impact of social dialogue on this